So it's very individual how often a pet might need to have their teeth cleaned. I recommend looking at your pet's teeth every day to see how things are going and ideally brushing them. I see 12-year-old dogs that have perfectly clean white teeth, no plaque or tartar on them. Never had their teeth cleaned their whole life, where I see some pets that are 2 or 3 years old that have a lot of tartar on there. And those guys are tartar prone, and those pets are going to have to be have a dental cleaning more frequently. We treat a lot of dental disease prophylactically by hopefully keeping the plaque and tartar down. Other treatments are going to be individual depending on what's going on with that pet's mouth. Oftentimes, advanced periodontal disease will loosen the tooth up, and that tooth has to be extracted. And trauma can happen to teeth, and those are handled differently. If a large canine tooth, for instance, on a dog, if it gets traumatized and it dies, then root canal therapy is a potential treatment option to save that tooth and keep it in the dog's mouth. Well, dog dental chews work by just the abrasive activity on the tooth surface of biting into something and biting on something, and that's just works essentially like how a toothbrush would work, just rubbing plaque off the tooth surface. Dental pain can show up in a dog with a variety of different things. One, you might notice that the dog doesn't want to chew very much. You may have excessive salivation going on if there's some dental pain in there. But they're pretty stoic about that. I see some teeth that, my gosh, must hurt like the devil, and not any sign at all of pain. That would be determined by who's ever writing the insurance policy, if dental care is going to be included in that package. The pet can feel so much better. It's amazing how little oral pain, dental pain the pet might be showing. You get all that stuff cleaned up, you get those gums healthier, get rid of loose, painful teeth. I have a lot of people say, my gosh, my elderly pet is like a puppy again. And also that big benefit of having some dental work done on your pet, either cleaning and extracting bad infectious teeth. The pet's breath can be 100% better. They are expensive for a number of reasons. One, they're doing some very specialized equipment, just like a human dentist. We have the high-speed scalers and polishers and drills and all the dental equipment that a human dentist would have. And then we have a patient that is probably not going to just sit there in the dental chair and allow us to do a thorough cleaning. And so anesthesia is important. Anesthesia is very, very safe these days, but it all has its inherent risks, and we like to make sure that we've got a patient who's in good shape before we do any anesthesia. So often pre-anesthetic lab work is done. Here at this hospital, we do a pre-anesthetic electrocardiogram, make sure that heart's beating just fine. And there's a lot of precautions that go into that type of procedure, and it all costs money. So to do a good thorough dental cleaning, yeah, there's some expense involved. Loose teeth are painful, and so those get extracted. Trauma can happen to teeth as well. They can fracture, and if that occurs, that can be a very painful situation, and that tooth may have to be extracted. First off, a bad infected mouth with a lot of tartar in it, the odor from your pet's mouth can be very bad, and that can just lessen one's enjoyment of having a pet up close and personal if their breath is so horrendous. Other benefits are just overall general health of the pet. We know that gum tissue is very, very vascular. It's got a great blood supply. Tartar and plaque and the things that build up on dogs' teeth are food, saliva, and bacteria. And bacteria can actually gain access to the bloodstream through the gum tissue and go out throughout the whole body.